Good evening, everyone. I'm Priya Bharti and I'll be your host for today's session. It's my pleasure to introduce our mentor for today's session, Ms. Surabhi Sharma ma'am. She's an assistant professor at Jaipur National University where she has been serving since 2021. She also serves as the coordinator for the School of Allied Health Science, reflecting her dedication to both academics and leadership. She's completed her master degree in forensic science and criminology from Bundelkhand University and brings a strong academic background along with valuable expertise in the field of forensic science. We are delighted to have her with us today and look forward to learning from her knowledge and experience. Please join me in giving a warm welcome to Ms. Surabhi Sharma, ma'am. Ma'am, the floor is all yours. Thank you.
Thank you so much, Priya, for your warm welcome. A very good evening to all the students. May I know if I'm audible?
Yes, ma'am.
Okay, so just 1 minute, I'll share my screen. Is the screen visible to everyone?
Yes, ma'am.
Okay. Just hold on. Okay, so I'll start with we have to cover forensic toxicology basically. So, toxicology is a very vast topic to cover. Starting with what toxicology is all about, what is forensic toxicology, what are the other types of toxicology that we are going to cover in this particular session. Then, what is toxins? What are poisons? Different types of toxins, different types of poisons, and depending upon them, a short case study I have put in my PPT for now. Tomorrow we'll be discussing about these poisons and analysis of various poisons as well as drugs. So I have kept my course basically into two parts. One is the gist of what forensic toxicology is all about and how forensic toxicology helps in death investigation. And tomorrow we'll be talking about the detailed things about all the drugs and all the poisons that we will be seeing in this particular presentation. So I'll start starting with what is toxicology. Now, toxicology comes from the Greek words toxicon, which was first used as a poisonous substance. Now, everyone must be knowing about arrowheads that were used before when these poisons were not into the existence. Everyone must be knowing, उन्होंने अपने दादी नानी सबसे सुना होगा. Even you must have seen in your these mythological series or some movies where they used to use arrowheads to kill people, and those arrowheads were already treated with any poisonous substance because of which the person used to die. So it comes from a Greek word that is toxicon, meaning poisonous substances. Then it is a science which deals with properties, action, direction, and fatal dose, autopsy findings, and treatment in relation to any poisonous substance, which means that how a particular poison is entering your body, how it is going to act in your body, and what are the consequences that are going to act on your body upon engulfing those poison. So it is a science that which deals with all of the above parameters. Then toxicology is scientific study of the adverse effect of chemical, physical or biological agents on living organisms and ecosystem. आपने देखा होगा, if we generally talk about poison in a layman word, it means anything in excess which cause harm to your body is poison. At an instance, even water becomes poison if it is in excess. For example, We drink water and it gives us hydration. But if we overdo it, our body becomes overhydrated, and our important elements from the body also get flushed out with those water. For example, creatinine, it also comes out from the water, and which affects our kidney, and because of that it may lead to kidney failure also. So over here we saw how water is beneficial for us in small doses or in required doses, but if we exceed to it, it becomes poison. Then we will be also focusing upon what are poisons, what are toxins, what are toxicants. We have heard about these all these words many times, right? So what is the difference between all these three words, we are going to discuss in further slides. Then dose response relationship we are going to study. Dose response relationship is, again, as I told you, that if we are taking something in a minimum quantity or in a quantity which is prescribed to be in a good amount, then तो we will be fine after taking those things. But अगर वो quantity आपने exceed करी, तो वो quantity आपकी body को affect करेगी, and effect इस तरीके से करेगी कि वो आपकी death भी cause कर सकती है. So we are going to learn about all these things in toxicology. Then coming, what are the types of toxicology? First one is clinical toxicology, which tells about the diagnosis and treatment of poisoning in human. For example, अगर किसी सांप ने अगर किसी को काटा, we give anti venom injection for to a person for his or her survival. That anti-venom injection is given upon studying up the person's physical features on biting of the snake. उसी डायग्नोसिस और ट्रीटमेंट को हम क्लिनिकल टॉक्सिकोलॉजी के अंडर पढ़ते हैं, जो कि यूजली डॉक्टर्स करते हैं. देन फॉरेंसिक टॉक्सिकोलॉजी, जिसके ऊपर हमारी प्रेजेंटेशन है, जिसके ऊपर हमारा सब्जेक्ट भी है. फॉरेंसिक टॉक्सिकोलॉजी वो होता है जिसमें हम इन्वेस्टिगेशंस के बारे में पढ़ते हैं, कि क्रिमिनल इन्वेस्टिगेशंस जिसमें टॉक्सिन्स इंक्लूडेड हैं और ड्रग्स इंक्लूडेड हैं, वो किस तरीके से होता है, दैट इज नोन एज फॉरेंसिक टॉक्सिकोलॉजी. Then we have environmental toxicology. Environmental toxicology is nothing but the study of pollutants and chemicals affecting ecosystem. आप में सबने एक केस बहुत पॉपुलर पढ़ा होगा, उसके ऊपर एक सीरीज भी बनी है आई गेस, जो भोपाल गैस ट्रेजेडी के ऊपर हुआ था, है ना. भोपाल गैस ट्रेजेडी में क्या हुआ था, मीथेन आइसोसाइनेट गैस जो थी वो लीक हो गई थी, जिसकी वजह से बहुत सारे लोगों की डेथ कॉज हुई थी, है ना. अब आपने ये भी सुना होगा कि बिकॉज ऑफ ग्रोथ ऑफ व्हीकल्स, फोर व्हीलर्स और सीएनजीज और ये हमारे जो एसीज हैं, जिससे एरोजोल्स, हाइड्रोफ्लोरोकार्बन्स ये सारे एमिट होते हैं, जिसकी वजह से ओजोन लेयर पे इम्पैक्ट हो रहा है. दीज ऑल स्टडीज विच टेल अस कि कौन सी गैस is fatal for our environment is learned or is studied under environmental toxicology. Then we have analytical toxicology. Analytical toxicology is the study of the measures which we take for you can say identification of different types of toxins and poisons. For example, अगर हमें किसी भी पॉइजन के अंदर कोई किसी भी विसरल ऑर्गन के अंदर या किसी भी बायोलॉजिकल सैंपल के अंदर ये पता लगाना है कि वो बंदा कौन सा पॉइजन खाकर मरा था, तो वी हैव वेरियस कैटेगरीज, लाइक वी हैव जीसी, वी हैव एचपीएलसी. जीसी मीन्स गैस क्रोमेटोग्राफी, एचपीएलसी इज हाई परफॉर्मेंस लिक्विड क्रोमेटोग्राफी. आई गेस यू ऑल हैव लर्नड अबाउट इट इन योर प्रीवियस लेक्चर्स. देन अगर कोई हैवी मेटल है किसी भी सब्जेक्ट में या फिर किसी भी स्पेसिमेन में, उसका अगर हमें पता लगाना है, तो वी हैव डिफरेंट इंस्ट्रूमेंट्स. अगेन वी हैव एटॉमिक अब्जॉर्प्शन स्पेक्ट्रोस्कोपी, वी हैव एक्सआरडी, जिससे हम हैवी मेटल एनालिसिस करते हैं. तो इन किस स्पेसिमेन में क्या एनालिसिस करना है, कैसे एनालिसिस करना है, ये सारा हम पढ़ते हैं एनालिटिकल टॉक्सिकोलॉजी में. Then we have descriptive toxicology, in which we describe toxic effects of substances through experiments and testing.
Everyone, please wait.
जैसे कि अगर मैं बात करूं डिस्क्रिप्टिव टॉक्सिकोलॉजी की, तो वी हैव वेरियस टेस्ट, वी हैव मार्कस टेस्ट, वी हैव राइंस टेस्ट फॉर हैवी मेटल्स, ये सारे टेस्ट मैं कल डिस्कस करूंगी अपनी पीपीटी में। तो ये सारी चीजें आ जाती हैं आपकी डिस्क्रिप्टिव टॉक्सिकोलॉजी में। देन कमिंग टूवर्ड्स फॉरेंसिक टॉक्सिकोलॉजी, मैंने आपको बताया था मल्टी डिसिप्लिनरी साइंस है जिसमें टॉक्सिकोलॉजी, फॉरेंसिक टॉक्सिकोलॉजी शामिल होती है, एनालिटिकल
Sorry for
टॉक्सिकोलॉजी।
interruption, ma'am.
या
Some student is facing problem in Hindi, so can you continue in English?
बट आई एम सेइंग इन इंग्लिश ओनली।
Uh, In between, you use Hindi, ma'am, so that's why
ओके, सो
I'm
या
cutting
आई
it,
वाज
ma'am.
saying कि what all we learn in forensic toxicology is combination of the study of toxicology. Then we have the study of analytical chemistry. Analytical chemistry means how we are going to analyze those specimen in which we have to find out the toxin or drug. Then we have pharmacology. Pharmacology is basically the study of drugs or basically medicines and all in terms of medical language. And clinical chemistry, that is analysis, or that is telling what kind of poison is that, what kind of poisonous death it must be, that is clinical chemistry to support legal and medical investigation. Now the term legal only tells that we study toxicology. Forensic toxicology is the word which helps us to find out the death, and which helps us to tell it in the court. Like whatever evidences we are finding out, it is just to tell in the court or just to justify our findings in the court and to get the culprit caught, है ना? तो that is why we use forensic toxicology and we study forensic toxicology. Then we detect and interpret drugs, alcohols. We have different types of drugs. We have narcotic drugs in which we have cocaine, we have heroin, which is also known as diacetyl morphine. Then we have amphetamines. Then we have alcohol, which is known as inebriant. So there are many drugs. We are going to talk about it in our later slides, and tomorrow I am going to talk in depth about it. Then sample collection, chemical analysis, and result interpretation. Now, this word sample collection comes from whatever samples we are getting in our labs to identify the type of poison. So in those, we can have our visceral organs, like we have spleen, we have kidney, we have heart. In some cases, we have kidney, we have heart, we have lungs also. But in common, we get spleen, we get stomach wash, and we get liver also. So these are the visceral organs that we get, from which we analyze the alcohol or drugs or poisons. Other than that, we have hair, we have nails for heavy metal analysis. So these are the things that we usually get in our FSS, in our labs, to identify the drugs and interpret the data about those drugs and poisons. Then post-mortem investigation, drunk driving cases, drug facilitated crimes, like we have rape drugs, we have supposingly we get a dead body and the person was brought dead in the hospital. So the person who is going to do the autopsy, who is going to perform the autopsy, he or she is going to write the physical as well as the internal features of that particular person. Now it is our duty, forensic scientist or forensic toxicologist duty, to find out the cause of the death. The person is going to send us the visceral organs, then we are going to put the test, chemical test or instrumental analysis on that particular visceral organ or particular exhibit that we are getting, and tell which kind of poison was included in the particular death. Then we provide crucial evidence in courts and support justice. Okay. Then coming to history of forensic toxicology, forensic toxicology is one of the sciences which comes from the Rig Veda century, that was 12th century itself. Many known poisons, जैसे we know about many plant poisons, like one poison is akada. We know akada is a poison that we even use for worships also. We know one poison that was dhatura. We know one poison that is ergot. We know the poison that is semicarpus anacardium. We know a poison which is known as calotropis. These are all plant poisons, but their existence is written way back in Rig Veda that we study now as plant poisons. So humans in ancient types use plant poison and snake venom for hunting, killing, and warfare. As I told you in the starting only, that you must have seen in many series or many movies that they used to shot an arrow. You know, even you must have seen that dhatura, which was used to use as an abortificant. The queens or the people who were jealous of the king or their kingdom, they used to give their childbearing mothers this dhatura, because of which they used to get miscarriages, again, which is used as an abortificant. So these are all the things which were which were written in previous books also. Hippocrates was one of the scientists who told about all these availability of these poisons and their remedy and their overdose also. Then in papyrus book, we have many substances, that is hemlock, opium, aconite, lead, copper, arsenic, etc., which is mentioned in that book as toxic. In 10th century or in 12th century, we used to use the utensils of lead. We used to use the utensils of copper, which were poisonous for us. But those vessels or those things were used in many of our utensils, many of our vessels, as storage for water, as storage for grains, etc. But their use in different way was injurious to health, which was written in papyrus book also. Then Hippocrates segregated various toxins as per their bioavailability, as I told you. Then Carl William Steele, he identified reactions that converted arsenic compound into distinctive gases or precipitates, and these laboratories advances began to be applied in criminal cases. And then one of our scientists, behind whom we perform heavy metal analysis also, is James Marsh. You all must have studied about Marsh test, which is used for heavy metal analysis, is because of this particular scientist only, who worked on the arsenic and detected in as a metallic mirror or stable precipitate under controlled conditions. Then scope of forensic toxicology. What are the scope? We have the scope in detection, we have the scope in quantification, interpretation, and medico legal questions. Coming to practical application setting, forensic toxicology operates in medical examiner, coroner offices, and hospital labs. Why? Again, to identify the poisons or the drugs because of which the death might have occurred. Then law enforcement forensic labs. We all know that we are forensic science students, and our work is to go into the lab and to study about the various suspects or various suspected what you can say, organs, or various suspected materials, or various suspected exhibits that come to us, and we need to tell what kind of poisons must be or might be possible in that particular exhibit. Then it supports criminal prosecutors, civil litigation, public health surveillance, and regulatory enforcement. And lastly, expert testimony and clear reporting are central functions that translate laboratory science into legal evidence. Significance. What are the significance of toxicological findings? Cause and manner of death. To determine cause and manner of death, I have said this multiple of times since I have started my presentation, that the core work of forensic toxicologist is to tell the cause and manner of the death, how a person might have died, and what was the cause because of the person might have died. For example, I'll just tell you one case or one case that I worked upon. A case came to us, and it suggested that the person got a heart attack. ठीक है, that was a case, and that was his autopsy report. And we got various visceral organs of the also of that person. And upon identification, upon performing chemical tests and instrumental analysis of that particular visceral organs, basically it was kidney that came to us. We find out that that particular person has died because of the arsenic, because of the heavy metal arsenic that was there in the body of that person. So there are many cases in which death seems to be natural, but then we have to find it out all in all the possible parameters, ki how the death has been caused and what was the reason of the particular death. Sometimes a person is brought dead in the hospitals, and the doctors send us the visceral samples to identify what was the purpose of death or what was the cause of death. And upon the toxicological analysis, we find out that the death was caused due to overconsumption of alcohol. So there are many other cases like this in which we have to find out, we have to do the quantitative results, and which can support our statement. It is not only that we can just say it like this, that it might be because of this particular poison or it might be because of this particular poison. We need to have a particular report, we need to have a particular scientific study, scientific backup, which suggests that our study or our claim is our claim is true. Then second one is impairment and criminal responsibility. To measure levels of blood alcohol concentration, you must have seen many police officials which are there on various checkposts, and which tell us about blood alcohol relationship. They carry those instruments which are known as breath analyzers, and they tell a person to blow into those breath analyzers, which tell how much percentage of alcohol the person has consumed, which might be beneficial or which might be fatal for that particular person. Usually it is used in drunk and driving cases. Then we have clinical management. In clinical management, we see patients in living patient toxicology guides, treatment, antidotes, what antidotes should be given to the person, as I give you the example of snake venom early only. So these are the particular things that clinical people only do, and it comes under clinical toxicology only. Then we have public health and surveillance, which is aggregated toxicology data reveal trends, that is emerging drugs, overdose spies, that inform prevention and policy responses. Like for example, I was just reading a news a few days back, and it was told that cannabis, which is illegal in India, is new laws are to be reformed on that particular drug. And the work is given to the Supreme Court itself, and the Supreme Court is working on the reforms or on the laws of the usage of this cannabis. Earlier also we know कि cannabis in small quantities or in specific quantities can heal problems related to our brain, that is dementia. Like dementia, we can treat all these illness with that particular herb or plant. But we all know that everything in excess which cause harm to our body is poison, and so is the overuse of cannabis has become a harm to our self. And the youth is basically abusing the use of those cannabis or alcohol, which is in turn is causing harm to their body. Then workplace and regulatory decision result affect employment, licensing, and safety compliance when validated methods and clear cutoffs are required. These are all the significance of forensic toxicology. Now coming to what is a poison. A poison is a substance which, when assimilated into the living body or brought into the contact with any part of it, cause deterioration of health or may lead to death. I told you in a very simple language, anything which which cause harm to our body, which is there in excess in our body. For example, if I talk about salt, I am taking very basic examples so that you can study or you can understand these with the help of daily activity, daily life activities. So I was talking about salt. Salt is a very, you can say, important condiment or ingredient in your food. But if we increase that particular salt in your diet, then it may cause harm to your body. It may cause blood pressure. It may cause your blood vessels to burst, or it may cause any severity. Plus, cut to now, if a particular person has engulfed poison, the first thing that comes in our mind as an antidote is what? That is to give that particular saline solution. You must have heard about that. You give saline solution to that person, and the person might vomit out all the drugs or all the poison that he must have engulfed, which may again save his life. So I have told you two or three ways in which a salt can be beneficial for your health. It might protect your life, and it might also affect your life. So in this way, we study poison. Ki anything which in excess harms our body is poison. Now we have three types of poison over here. Acute poisoning. Acute poisoning means the poisoning effect which is very sudden. Like if you have taken a particular drug and death is caused, then it is known as acute poisoning. Second is chronic poisoning, a poisoning that occurs in your body in a particular period of time. For example, I'll take a very good example, that is Itai disease, Minamata Bay disease. These are all the diseases which caused metal toxicity in a particular person. People used to eat fishes over there, and the mercury level which was there in the fishes, which was due to water, it got accumulated into human body, and a day came when the person was ill because of that particular metal. So that is chronic poisoning. And then we have fulminate poisoning. Fulminate poisoning is a poisoning in which death is occurred by large overdose. For example, alcohol overdose. For example, you can say opium overdose. For example, sleeping pill overdose, very common example. A sleeping pill which is prescribed by a doctor is given zero point 0.5 mg or 0.25 mg depending upon the person's condition, and is prescribed one per day. But if a person is taking it in 5 or 10 in one go, the person may also die, which is known as fulminate poisoning. So I hope the types of poisoning is clear to you all. Then we have types of poisoning, which is homicidal poisoning. Homicidal poisoning is a poisoning which is deliberate administration of toxic agent. Like if you poison someone, if you know that particular thing will cause death to the person, and you have given it to that person, it is known as homicidal poisoning. And very common example for this is Jamal Gota, which is again a kind of plant poison. If you are giving a Jamal Gota to a person, it might even cause the death of the person. And it is said homicidal poison. And what are the features of homicidal poison? Is it showed sudden illness, like it acts like a fulminate poisoning only. It acts sudden illness, death, and access to lethal substances before the death was occurred. Then we have suicidal poisoning, a poisoning in which we engulf or administrate that particular poison by our own self. We know that particular thing is very harmful for us, and still we are taking all these things. That is suicidal poisoning. For example, many cases come in which a person has engulfed this mosquito repellent, or the person has taken naphthalene ball, which are very poisonous. They are very common in household, but if a person take it knowingly, it is known as suicidal poisoning. Then accidental poisoning, again I'll take this example of these particular household items, that is naphthalene balls or mosquito repellent or detergents, etc. If a person is taking it by chance, or if a person is taking it mistakenly, and if it is causing death, it is known as accidental poisoning. What are the features of this? Children and elderly people are usually the common victims. Like, very common example again of your household, you have seen your mothers keeping detergent in your Horlicks tub, or you must have seen or children you must have seen, we used to get coconut balls of coconut balls which we used to eat as a candy. You must have seen, and it resembles naphthalene balls. There are many cases in people in which people accidentally engulf naphthalene balls, and in place of those coconut balls, or people they drink this detergents, etc., in which children are playing with thermometer, and mistakenly they engulf the mercury which is there in the thermometer. So there are many cases which might occur accidentally too. Then we have cattle poisoning, which is exposure affecting livestock due to contaminated feed. You must have seen many houses in which we have oleander plant. Now, if I tell about the Hindi name, that is kaner ka ped. You must have seen in many fences. Why that plant is kept in the fences is because it acts as cattle poison. Those plants are planted in the fencing of all the houses because to protect that particular house from the cattle. And it features multiple animal affected, sudden hard illness, death, possible economic or criminal motives. Like, if someone's cattle is there, you go and give some kind of poison to that particular cattle in food, in hay, in whatever thing you are giving for the consumption, and the particular cattle dies because of it. That is known as cattle poisoning. And then we have miscellaneous, which in which we have judicial death and abortificants. Abortificants could be anything. I have told you one abortificant already, which was discussed earlier in this particular slide. And then for judicial death, you must have seen people used to take, or people used to like diamonds in judicial custody, so that they can die. All those poisons can come into miscellaneous poisoning. Then we have types of poisonings. In types of poisonings, we have volatile poison first. Volatile and non-volatile poison first. In volatile, we have alcohol, chloroform. These are all why volatile? Because they, what we can say, uh, they they go off into the air very easily, and that is why they are known as volatile. Which, for example, we have alcohol, chloroform, ether, acetone, and nicotine. Then we have non-volatile poisons, in which we have all the other drugs, in which we can have sleeping pill, painkiller, antidepressants. And yes, these medical medicines which are prescribed in day-to-day life to many of the people, they act as poisons if taken regularly, if taken in excess, or if taken continuously. Then we have another type of poison category, which is toxin, anion, and cation. Anion, we have cyanide, phosphate, and chloride. Cations, we have all the heavy metals, mercury, arsenic, lead, etc. Then pesticides, we have DDT, malathion example. What are pesticides? You can see for killing mosquitoes, for cockroaches, and for other pesticides also. Then coming to miscellaneous, in miscellaneous we have animal poison, vegetable poison, and food poisoning. Animal poison, we have snake venom, insect bites, and all the particular animals which have venom in their body. Vegetable poisons, I told you about plant poison. I have listed some plant poisons also to you all. Datura, cannabis, calotropis, argot, semicarpus, anacardium. All these are all vegetable poisoning. And then food poisoning, in which we have various bacteria. Like one of the common food poisoning is botulism, etc. Coming to types of poisoning on the basis of mode of action. In that, we have first one, corrosive poison. Corrosive, we have strong acids and strong base. Corrosive itself means the particular poison which on coming in contact with your body erodes or corrodes that particular part. For example, you must have worked with hydrogen sulfuric acid in your labs, or you must have seen hydrochloric acid. These are very strong poison, and if mistakenly they come in contact with your skin, they have the power, they have the potency to engulf your skin also. So these are corrosive poisons. Then we have strong bases in which we have sodium carbonate, sodium hydroxide. Then we have irritants. In irritants, we have metals like, again, heavy metals we have, in which we have mercury, arsenic, lead, copper, etc. Non metals, in which we have chloride, cyanide, phosphate, etc. Mechanical, we have diamond dust, we have sponges, all those potent drugs or poisons which we can basically engulf, or which comes to our body with the oral route. Those are all known as mechanical poison. Then we have systemic poison. In systemic poison, we study about the poisons depending upon their effect on a particular system. Like cardiac poison are the poison which affect our cardiac system, which causes heart attack to a person, which can cause our heart to stop, which can cause arteries blockage. Those are cardiac poison, in which we have digitalis and nicotine. Spinal poisons are the poisons which affect our brain. For example, nux vomica. Then we have asphyxiants, which affects our lungs, in which we have carbon dioxide. Most common poisoning is carbon monoxide poisoning, which is caused by carbon monoxide, in which our hemoglobin becomes rich in carbon monoxide instead of oxygen, causing carboxy hemoglobin, and which cause death. Then we have war gases. Then we have peripheral, in which we have conium. Then we have cerebral poison. In cerebral poison, we study about the poisons depending upon their effects on our central nervous system. So first one is stimulant. Stimulant is the a type of drug which kind of awakens us, like like cocaine, nicotine, and very common that we use in our day to day life is caffeine. Second, depressant. Depressant is a one which causes depression in our body. In these depressants, we have three stages. Like first is stage of excitement, second is stage of stupor, third is stage of necrosis or stage of death or coma. So these are barbiturates, tranquilizers, anesthetic, inebriants, opiates. Opiates we study about opium, heroin, and pethidine. Then we have deliriants. In deliriants we study about cannabis and atropine and hallucinogen, which basically affects our brain in such a way that we see, we hear, or we feel something which is not actually there, which is like, for example, LSD. We have many types of hallucinogen. We have auditory hallucinogen, we have occipital hallucinogen. Depending upon the types, it affect our body organ or sense organ. I am talking about these poisons in a like for the purpose to make you understand what are all the categories. I am going to talk about these poisons in detail tomorrow. I hope you have understood about the types of poisons. Now, coming to forensic toxicology in death investigation. Basically, our work is to do death investigation, and how forensic toxicology is linked with it, which is sample collection. Again, sample collection, we have your peripheral blood, central blood, urine, vitreous humor, liver, gastric contents, and some other organs in special cases like lungs, heart, kidney, etc. Then we have screening and confirmation. For screening, we do particularly your this chemical test. I have told you about the chemical test also. We have Ryan's test, we have Marcus test, we have Scott test. There are many tests which are done for the analysis of drugs. Then we have this instrumental analysis, and in instrumental analysis we have this particular instruments which I have already discussed with you all in above this slides. I have told you about gas chromatography, I have told you about high performance liquid chromatography, I have told you about XRD, I have told you about AAS, and I'll be discussing about them tomorrow as well. So for that we have sample collection, screening and confirmation, and interpretation. In screening, I have written one term as LCMSMS. What is this? Liquid chromatography, mass spectroscopy, mass spectroscopy. There are many attachments made to these particular instruments, like we have GCHS, headspace. Why are these particular instruments used? Mass spectroscopy or mass in which we use mass spectroscopy or mass spectroscopy. In that particular instruments, we are basically trying to find out the particular mass in that particular poison, basically. Like supposingly we have got blood for analysis, and I have kept the blood for analysis in GCMS. Now that particular GCMS is going to tell me what kind of poison was there in the blood. Also it is going to tell me in what amount the particular poison was there in the blood. So this is the work of mass spectroscopy. What is the work of head space? These are basically used for volatile poisons. Okay, so once again I am going to discuss about them. Then we have interpretation. Interpretation means it integrates concentration with tolerance, medical history, autopsy findings, scene evidence to reach a forensic opinion. Now, coming to the next slide, these are the samples that are collected. We have stomach, we have cerebrospinal fluid, we have vitreous humor, we have lungs, urine, bone, hair, maggots. Maggots are the basically insects that are found on the dead bodies, and these maggots also play a very important role in telling us about the type of death, or how a person must have died, or how much time the person. How much time has passed by when the person is dead. These are all the things that we can see, or we can learn from maggots. And the field particularly in which we study them is known as entomotoxicology. Then we have nails and we have skin. Collection procedure I have written over here, and how much sample also I have written over here. I'll once again tell you. Stomach 500 ml, in which the whole stomach wash is taken, because basically digestion takes place in stomach only. So we need to have stomach wash to tell which kind of poison a person has taken. Then CSF is cerebrospinal fluid, in which we do lumbar puncture from the magna, inserting a long needle, and 15 ml is taken. Vitreous humor is found in our eyes. Hypodermic needle is taken, 20 gauge, 2 to 5 ml is taken. Lungs, main bronchus is tied off and tightly taken with the ligature, and 30 gram is taken. Urine we take from bladder or via catheter, and 30 ml is taken. Bone is taken, a shaft of femur 10 to 15 centimeter. Hair is plucked with roots. For heavy metal analysis we take 10 gram, and for DNA we take 0.5 gram. Maggots, we take all the maggots probably, and we drop them into absolute boiling alcohol. Nails, again we take all the nails. Skin, we take all the surrounding tissues. One thing is missing in this is blood. So for blood we take again 30 ml or 10 ml as required by the scientists. Now, preserving of viscera. Once we have taken these visceral organs, we need to preserve those viscera. Why need we need to preserve those viscera? To tell how the person has might have died, to tell that if the deceased was intoxicated, or was dead due to use of drugs, the death was accidental, it was criminal abortifacient. In all these cases we need to preserve the viscera, because this is going to go to the lab, and as we know we have many pendencies in our lab. So visceral organs need to be preserved and kept safely for analysis as per the cases. Then preservatives used for viscera. We have different preservatives. Most common preservative that is used for visceral organs or viscera is saline solution. Then, apart from saline solution, we have formalin, we have sodium fluoride, we have freezing, like we have to keep it in deep refrigerator also. We have formalin, and we have 5% albumin normal saline solution for the other things. So, I have written over here in what sample types, which preservatives is used, what are the primary purpose, and what are the concentration in which it is used. Then coming to chain of custody, which is very important in maintaining or in solving any case. We have all heard about a law of forensic science in which it is said no analysis is better than the sample analyzed. In that particular law, we have studied, we have understood that a sample analysis is very much mandatory, and to keep the authentication of the analysis of the sample, we need to maintain the chain of custody. For chain of custody, we have to follow the following uh, steps, that is collecting and labeling the samples at a scene. We have to note the preservatives. The persons who have interest in working in toxicology, I would like to tell you, when the toxicology samples are sent to the lab, a report is formed, a report in which have we have medical report if a person is alive, or a autopsy report if a person is dead. Then we have a panchnama or a report of police station. Then we have the seal sample of that particular exhibit. Whatever seal has been put onto that exhibit, a sample seal will be there in the file for the same. And basically a preservative sample will be also attached to that particular exhibit for a scientist to understand that if a peak is coming for any other object, it is that particular preservative. ठीक है. Then we have complete chain of custody form. I have also added the particular form, example of a format in which we fill all the details like the date, the time, the temperature, who was the investigating officer, who was the first responding officer. All these details are filled in particular COC form. Then we have seal and photograph of evidences, packages, records, seal IDs, etc. Then we have to transport it securely with documented custody and temperature control and confirmed lab receipt. This is the most important thing. When an IO goes to the lab for submitting the case, he has to give all the documents to a lab. Without that, a lab will not accept the case, and the IO needs to get the lab receipt, internal receipt, because if he will not get the receipt, that particular case might be mishandled, and then the whole blame is to be of the IO who is giving those case to the lab. Then screening and confirmatory test of the particular this uh, all the exhibits. We have first one as immunoassay, in which we have ELISA or EMIT. It is used for screening of opiates, benzodiazepine. Then for sensitivity and specificity, we it is moderately sensitive to all these particular drugs, and may be possible that false positive results may be given. So it is used as initial screen only. Then we have GCMS, which is used for volatile, semi-volatile drugs, and in for classical drugs also, like for example, alcohol or particular insecticides, etc. Then sensitivity, it is highly specific, and it may be used as confirmatory test also. Then we have LCMSMS, which is used for polar drugs metabolites, which is again very highly sensitive, and confirmatory and quantification can be done with the help of LCMSMS. As I told you earlier, only MSMS is used for telling the quantity of the poison in a particular exhibit. Then we have headspace, that is GCHS, which is used for volatile poisons like ethanol and other volatiles like chloroform, etc. It has very high specificity for volatiles, and it is used in ethanol quantitation. And then we have ICP-MS, inducted coupled plasma mass spectroscopy. in which we can use metals and inorganic poison, heavy metals and inorganic poison. It has very high sensitivity and it is used for metal poisoning test. Then interpretation of tests. Why do we need to interpret, or what are the principles? First, analytical reliability. That means confirmation. We get the confirmation with the interpretation of results of these instruments. Then sampling constant, that is used appropriate specimen and record collection timing and preservatives. Postmortem changes, that is account for postmortem redistribution, integrative case evaluation. Then these are the interpretation of result. We have analytical confirmation, in which it shows about the substance identity, concentration, sample metrics, in which it shows stability and representativeness. Pharmacological context, that means the toxic potential of a particular drug or poison used. And the postmortem effect, that means a redistribution of degradation risk. Then I told you I have kept some case study. These are not the descriptive case studies, as I will be discussing on day 3, but I use these case study to tell you all about what poison can actually do to a human being. That is, first case is endosulfan exposure, Kasargod, Kerala, which occurred on October 2020, in which aerial spray of endosulfan over cashew plantation caused toxicity into people, which caused death of the person. Again, a very good example of chronic poisoning. Second one is Karnataka Tamil Nadu methanol hooch tragedy, in which methanol, we all know alcohol has ethanol percentage in it, and if we add methanol percentage to it, it becomes poisonous. And so this particular factory did it. Added methanol into that particular samples, and on analysis of that particular sample we got that methanol was used, which caused death in the death in many living beings. Again, an example of acute poisoning or fulminate poisoning. Then Bhopal methyl isocyanate disaster. I told you, discussed about this case in the starting, that this particular gas was leaked from a factory, which caused many deaths into the city. The death counted increased like anything into the city. Example of fulminate poisoning. And the case 4 is pyridine facility, which is again a case reported in 2023, in which your pyridine was found in human cadaver. Documenting analytical workflow and interpretation was done with the help of GCLC MS confirmation that told that this particular insecticide is fatal for the human. That's all for today. Tomorrow I'll be discussing about the different types of poisons, drugs, and their analysis. Any doubts, anyone?
Everyone, if you have any doubt, you can unmute your mic and ask
Ma'am, on
questions.
doubt, ma'am.
Yes.
Ma'am, food cause to death. Which poisoning, ma'am?
What?
Food cause to death, ma'am.
Food?
Food.
Food. I am not understanding the next word. What are you saying, beta?
Ma'am, unexpired food cause to death, ma'am.
Can you please write your question?
Okay, ma'am.
Any other student, if any doubt is there? Beta, please
Yes, ma'am.
unmute your mic.
Good evening, ma'am.
Good evening.
Ma'am, I have one question. Ma'am, why is the sodium fluoride added to the blood sample collected from a forensic toxicology examination?
Because it helps in anticoagulation of the blood. That means blood will not be coagulated if we add sodium fluoride to it.
Okay, ma'am. Thank you, ma'am.
Okay.
Ma'am, uh, if a body is degraded and it is very old, then also can we determine that it died because of poisoning?
If a particular body is degraded or the bones are left, then we'll go for anthropological analysis better.
Okay, ma'am.
I guess that's it.
Anyone else?
Ma'am, I have a question.
Expired food to cause death. Beta, expired food basically has the growth of organism or bacterial growth which cause death to a person.
Ma'am, can I ask a question?
Yes.
Ma'am, when a person dies because of the medicine as well as the alcohol, when a person is intaked with the alcohol and then they admitted in the hospital and because of the medicine, so in those cases, like how do we identify whether that person has been dead because of the alcohol or because of some medicine reaction? So in
Okay.
those,
So when we have the visceral analysis, in that particular visceral analysis, we can find out the person is dead because of alcohol consumption or because of some medical, sorry, some kind of medicine response to that person.
okay, ma'am, thank you.
Okay. And also one thing that you have heard about one term which is known as synergism. What is synergism? Synergism is basically when we add two particular drugs together. Like if we are taking alcohol and if we are taking sleeping medicines together, those may prove fatal. Okay, so this is basically the effect of synergism, which can affect our body, and it can be find out with the help of visceral analysis.
Okay, ma'am, thank you so much.
Okay.
Anyone else? Okay, so if you don't have any further doubts or questions, so we conclude this session. So thank you so much, ma'am, for such an informative and insightful session. We truly appreciate your valuable time and guidance. Thank you to all the participants for joining today's session. We will continue the remaining part of today's session tomorrow. With this, we conclude today's session. Have a great evening ahead. See you in next session. Thank you so much.
Thank you so much. Thank